Good morning, everyone. We're about ready to get started. Today for the training, just for all of you out there, we have probably just under 300 people in the room, and we're web streaming this, and we have another 1,500 joining us by remotely by web. And so the speakers, just as a reminder, are going to have to stand right here so that camera can get us and project us out onto the rest of it. So I'm going to start out talking about the folder you received when you came in. Those of you on the web have received this electronically. On the left side of your folder, you have 3 documents. There's a day 1 agenda, a day 2 agenda, and then there are full speaker bios. I'll go over those, but not in as much detail as you have right there. On the right side of the folder, there are a number of packets that are stapled together. You have case studies, there are acronyms. We also have some practice coding scenarios. And the other thing that you'll see in there are action plans. It's something you'll hear a lot more about as we go through the 2 days of training. We actually want you to start setting up goals for rolling out some of this measures training when you get back. And like all goals, they'll have measurable outcomes and they'll be time bound. So that's the packet. The other things I have a couple of housekeeping items. You have bathrooms if you're in the room that are out and to the left. We do have wireless internet in the room if you'd like to use that. If you'll go on and find the Four Seasons meeting, the code for that is CMS, and you'll be able to sign in. And I'd like to tell you all to go ahead and pull out your laptops and your cell phones because we're going to have an interactive program today. We have a number of polling questions. This will be the way that you're able to submit questions directly to the speaker so that they can respond to those. And we'll also be using that as part of the action planning. So go ahead and get those out. So on today's agenda, we're going to start out with a talk just on the overview of the changes to the minimum data set. We're going to go into a second talk by Jen Pettis on Section M, skin conditions, and then we'll take a break. We'll have one more talk by Terry Ng from RTI, and then we'll go to lunch. Lunch will be from 11 till 12:45, and there will be a list of restaurants that are in the area that are available on the back tables. Those are provided by the hotel and list restaurants that are all within walking distance. All of them are really good around here, and you'll return at 12:45. In the afternoon, we're going to have 2 sessions, one on Sections I and J updates, and the other on Skilled Nursing Facilities Quality Reporting Program. Those are by Ann Deitch and Deb Weiland. And then we'll have a break, and we'll have one more session that'll be for everyone on the web and in the room. That'll start at 3 and go till 3:30. It'll be questions and answers and wrap up. And what they'll do during that session, they'll take all the questions that you've asked during the day, and they'll go through and try to order those and answer some of the ones that have been asked most. And there'll be a panel up here that'll answer those questions for about a half an hour. Following that, the web session will end. That won't be this last session that's called We Want to Hear From You is not going to be web broadcast. It'll be for those of you in the room, and it'll be more of an interactive session, and it's run by CMS and one of their contractors that will be trying to get some additional information about how you use this information and what your life is like out in the field and how they can support you. So with that, I'm going to talk just briefly about some of the presenters. As I said, we've got bios that are in the packets on the left side, so you'll be able to look at those if you want more information. First up is Mary Pratt. She's actually the director of the Division of Chronic and Post-Acute Care in the Quality Measures and Value-Based Incentives Group at CMS. which is a mouthful, but Mary's the one that's responsible for a lot of the implementation of portions of the IMPACT Act, which is working not only with SNFs, but also with inpatient rehab facilities, long-term care hospitals, home health agencies, and hospices. A lot of the work she's done at CMS has been in quality improvement and patient safety and measures development, and she's worked there since the agency was called the Healthcare Financing and HCFA, before it was CMS. I've forgotten, and I was there at the time. Healthcare Financing Administration. So she started in '85 and has been there a long time. She has a lot of experience in this, and she leads the group that's doing the training today. Second, we have somebody from Apt Associates, Jen Pettis. Jen is a nurse and has a master's in science. She's done a lot of work in nursing homes. She's been involved in the Nursing Home Compare and Nursing Home Quality Assurance and Performance Improvement programs. She has over 25 years of experience, and she'll be talking about a number of aspects of this. One of the things that she really draws on is her ability to knowledge of use of the data in the field to actually make improvement. Next, from RTI, we have Ann Deitch, and Ann is also a nurse and has a doctorate in epidemiology and community health, and she's worked extensively in the post-acute care payment reform demonstration. She's from Chicago, from their offices there, and she has an appointment at Northwestern University's Feinberg School of Medicine. Next, we have another colleague from RTI, Terry Ng, and Terry's also a nurse and has a doctorate in research. And she's worked in the Boston area at Brigham and Women's Hospital, and she's done work not only in long-term care, but also in hospital-acquired conditions and a number of other settings. And so that's kind of the lineup. One other speaker today will be Deb Weiland, and she'll be our first speaker today, subbing for Mary Pratt. And so I'll wait to introduce her. So just some additional general information. All the training materials with the answers are going to be posted on the SNF QRP training page on the CMS website. Video recordings of today's presentations will be posted to the CMS YouTube site, and those will be chopped up so that you can watch them in about 1-hour segments. Those are very handy if you want to go back and review any of the information. And past training sessions that we've done are already up there if you want to go look at those. There will also be certificates of completion for everyone who's attending in person today, and those will be mailed out via email in the next week or two. And now I'd like you to go ahead and get out your cell phones or your laptops. And this is going to be very important. And they gave me the job to do this because if I can get it done, anybody can get it done. So the first thing you need to do is go to slido.com, and that should be in some of the material that you have. slido.com. Okay, have you had a chance to do that? Everybody's about there? As you get on there, you're going to need to sign in, and there will be a little blank there. It's got a hashtag next to it, and you need to type in Econometrica, and that's spelled ECONOMETRICA. And if you like that, you can come to work for us, where I have to type in Tom Jackson at econometricainc.com. So that'll get you into the site. And as and you're logged into this session. The next thing I'd like you to do is go ahead and set up your profile. And so you'll see a page that has a little icon at the top. It looks like a little person, the head and shoulders. If you push on that, you'll be able to set up your profile. And we want you to enter your name, the organization you're from, and your email. Bridget, have you got it set up yet? Are you in? Are others in? Can I see some hands if you've gotten in yet? Because I don't want to go too fast. Because the next step we're going to do is just try it out. And what you'll see once you get it all set up and your profile set up in the blue band at the top, there are 3 words: questions, ideas, and polls. And if you push on questions, you'll be able to type questions in there. Ideas are going to be related to those action plans in a little while. And what we want to do right now is polls. And we're going to do polls throughout the day in all the presentations. And just to try it out, I want you to go to polls now and go to questions. Polls. And I'm not seeing it on mine, so I'm just going to look down here at the screen. The first question's up here, and you can see it on the screen, and you should be able to see it on your phone. What popular street vendor food was invented in Baltimore? A, hot dogs, B, snow cones, C, popcorn, or D, roasted peanuts? And as you start putting in your answers, I'm not sure if you can see this in the web broadcast, but in the room here, you're able to see on the screens and on your phone or laptop exactly where people are right now as far as their voting, and those are changing as the numbers are going up. And you'll see some light gray numbers in the upper right that tell how many people have voted so far, and we're up to about 250. And at the moment, it looks like snow cones is winning, roasted peanuts in second, hot dogs close behind. And this is important for those of you who are on the web as well. If you are with a computer or a cell phone, and I'm sure you are, you're going to be able to log in, and we can also get your votes tallied on this as well. So these numbers should go up to about 500 or 600 as we go through the day. All right, I'm going to go ahead and go to the answer, and I think Ethan has already gone to it. Correct answer is snow cones, which everybody got. Okay, so here we have another one. What school of healthcare was first established in Baltimore in 1840? Is it A, nursing, B, chiropractic, C, dentistry, or D, laser eye surgery? We've got 160 voted, 170. So far it's nursing, winning out over dentistry and chiropractic. And somebody guessed that eye surgery was invented in 1840. All right, we're up to about 300. Let's go ahead and go to the correct answer. Dentistry. And that one threw me too, because I knew we had a school of public health here that started a long time ago, but I didn't know about dentistry. Okay, next one. We'll do a couple more just so that people have the hang of this. What vital public institution was first inaugurated in Baltimore in 1774? Is it the fire department, the movie theater, the ice cream parlor, or the U.S. Post Office? And we're up to about 250. All right, somebody's given the answers. I can see you. All right, let's go ahead and go to the right answer. It is the U.S. Post Office, not the most important public institution, which of course is the ice cream parlor, but the one that was invented here in 1774. All right, next one, Ethan. First successful unmanned blank was launched in the United States in Baltimore in 1784. Is it A, the airplane, B, the rocket, C, a submarine, or D, a hot air balloon? Remember, there are only 29 votes so far. Don't be swayed. And the correct answer on that one is hot air balloons. There's some people at a table up here who know all the answers already. All right. So pull out your phones again. And what I want you to do this time is go to the questions tab. And we already went through the quick profile setup. Did everybody have a chance to do that? And that helps us too, because we can just see where the questions are coming from. You can actually do this without that, but it helps to know where the questions are coming from. So how to ask questions. If you push on that questions tab and you go down to type your question there, all you have to do is use the keys on your phone to type those in and then push send, and your question will be submitted. And we're collecting all those in the back. And one of the things that is helpful about this, if we had 250 of you asking exactly the same question, it'd be hard to go through there and sort those out at the end of the first half of the day, so that the people at lunch, our expert panel, could go through and answer them. So if you go on there, you're actually able to see the questions that have already been answered or asked. And if you see your question or something very close to it, go ahead and just vote on that one. It's like, I'm told, liking it in Facebook. And that'll help us prioritize some of these. And then the next thing I want to show you, and then we're about to get on to our speakers, is the submitting ideas. And on this one of the things that we wanted to do this time was really move this toward action. And there are going to be action plans, as I told you, on the right side of your folder. There are some that are they're going to ask you to fill out as we go on through the day. But we'd also like you to put things into the computer, into Slido. Ideas that you're considering doing it, those will be shared with everybody who's here today and everybody online. I'm sure it'll be shared on websites as well. Just some ideas, some practical ideas, because a lot of times knowing this stuff is actually the easy part. It seems like implementing the stuff when you get back is going to be easy, but it takes a little bit of work. It takes a lot of effort and thought to move a big group of people in an organization like the organizations you're a part of. There are lots of people, they have lots of backgrounds, they have lots of feelings about how things should go. They don't always do things the way that you would expect them to do or the way you want them to. But if we could share some ideas about how to operationalize this when you get back, that would be very helpful. And perhaps we can even call some of you and see if you've been able to implement your ideas just to move things along a little bit. That's about all for Slido right now. But as I said, every one of the speakers is probably going to have a few polling questions. And as they have those come up, you'll need to pull out your computer and be ready to go. So our first speaker today is Deborah Weiland. She's going to sub for Mary. And Deb Weiland is also a nurse. All the speakers today have a clinical background. They've got practical experience working in, at the bedside in hospitals and nursing homes. Deb is over here to the right. She's also a coder. She's certified in resident assessment coordinator coding certification, and she maintains that through the American Association of Nurse Assessment Coordinators. She's worked on all sides of this, not only clinically in the healthcare setting, but she's worked with groups that have developed these measures, have implemented the measures, have used them for quality improvement, and now she works for CMS, leading some of these programs. And so with that, I'd like to introduce Deborah Weiland.